When I first came out of school, I was able to get a position where I worked with a group practice, which was really perfect because you had a lot of doctors in one location and just really helped with my training. You had people that were experienced that could help you with difficulties you might be having with a patient. So I learned quite a bit. You know, you always sort of want your own business. That was the idea of going into dentistry for me. You want to be able to call your own shots and sort of set your own standards and be responsible for setting those standards and making sure that quality and the staff and all the things that go with running a business. There were two brothers in Southfield here that had a dental practice that were retiring and selected me to take over their practice. That's when I first came to Southfield. I've been in Southfield over 20 years now. A lot of my patients were patients from those two brothers. And so I've got a practice here that really probably spans 50 or 60 years. And so it's very fun to treat patients of all ages and to see people grow with you. It's like a family. You don't realize how much you're going to get attached to the people that you work with, but it's really rewarding. It's a very wonderful career to have.
We had dated as high school sweethearts. We ended up getting married after he graduated from dental school. When we were married, I was a pharmaceutical rep. I received a business degree from Michigan State University. And then as the business started to grow, I was invited to work here, first on a part-time basis, doing the books, and then as the business grew, I was invited to do more aspects of dentistry.
With the technology that we have, with computers, with digital x-rays, with the need to be able to move things in and out of the operatories, it really just got a little too tight, a little bit too small for us. We've been looking for a nice location within Southfield that would meet our needs, and when this property came up, it was perfect.
We had an architect that worked with my husband and myself to develop a flow to the office that would be very good for delivering dentistry, but more important for receiving dentistry. This facility is fully handicap accessible, so patients who have walkers or wheelchairs, it's very easy for them to negotiate to get into the operatories and the chairs. Parking, we have ample parking outside. We had to make a lot of decisions, many of which were a little bit difficult, such as colors and placement, but we did a lot of things to make the patient feel more comfortable. For example, in the operatories, we have windows that are designed so as the patient is seated back, they look out onto a blue sky. Just subtle things like that that really do help make a difference for the patients.
Very warm and welcoming. It's my kind of colors because I like these kind of colors. You feel like you're getting enveloped when you come into the office. I love the staff. I crack jokes with them all the time. So my every 6 months coming in is like party time at the dentist office.
The new location, patients just love it. They can pull up, walk right in our office. They don't have the long walk to the building, and the parking was an issue before, but now it's park right outside the building and walk right in.
We are a family dental office, and we provide all services from basic cleanings, x-rays, diagnosing to fillings, cosmetic work such as bonding, veneers so we can close spaces. We do root canals, which is in our term endodontics. We do dentures that are natural looking, that fit, that patients can speak. There's different aspects of dentistry now, and it's very exciting this time in dentistry to be able to provide a wide variety of procedures for patients.
This is where we do our dentures, and we use the model trimmer to trim models, pour up the models, make stints that we need to make to help with the dentures, waxing them up for try-ins. And Dr. Uppleger goes above and beyond what most dentists do to make the denture fit right. He does an extra step. Making partials, there's an extra step that he does where he actually cuts the model, takes another impression after the framework is here, takes an impression with that in, and then he repours that up with the other existing model that he had, and it makes a better fit for the patient to have so that they have less problems with their partials. A partial is a half of a denture. They still have some teeth, but they have a partial that will hold on to the existing teeth so they have chewing ability in the back.
The great thing about Dr. Uppleger is that when I came to him, he had a plan. And he said, by the time you retire, I will take care of everything that is wrong with anything in your mouth. And then when you retire, you won't have to worry about, doing any major dentistry. And that's exactly what happened.
The knowledge that Dr. Uppleger has of dentistry, he's always right on top of the cutting edge techniques. And his staff is too. They're always taking classes and learning new things, and they bring it to their practice.
I do all forms of dentistry. I'll do endodontics, root canals. I will do oral surgery. I've been doing this for a long time, and I'm capable in many different parts of dentistry. We place implants here. We do all restorative work. I can do very comprehensive cases, patients that really have problems with their bite and with their teeth. We can find ways to transition them into something that will repair their mouths, but maybe do it over a period of time to make things a little bit more affordable for patients.
We offer Care Credit, which is a charge card that you would apply for, and it allows patients to make monthly payments. They have interest-free deferred plans, which allows them to go forward with the treatment instead of postponing treatment. And then if you postpone treatment, generally it costs you more in the long run because you're involved with more extensive care if you postpone treatment. So Care Credit is an option a lot of our patients like.
I think with my training and with the great staff that I have, we have ability to really help all kinds of people that are very fearful. To me, you have to be able to help little kids and 95-year-olds.
Basically what we do is we explain to them what's going on, and if you explain to them, they're not caught off guard, they understand, and then when they get their dentistry completed, they feel very successful and they feel very proud. And of course, we emphasize that they should feel proud.
The way you want someone to leave is that people will say, wow, you look really good. I don't know what it is about you, but you look different, you look better. And that's how you want anything you kind of do to try and improve someone's appearance, not be such a dramatic change that it looks phony or it looks fake. You want something that's going to seem natural to the person. And I think that's the artistic part of dentistry. That's the part where you got to get to know a person's personality and do things that fit for them. And that's a lot of what dentistry is. It's relationships with your patients, understanding them, being thoughtful to their needs, just listening.